long-term care nurses, long-term care providers, are you remembering to think about or even use this resource? So sometimes I'm guilty of forgetting about this too. Back in when I first started nursing school or working as a nurse, it was called an e-kit. But now what is it? A Pyxis, a something cell. Anyways, this is one that you want to nurses and providers, if you're working in long-term care, to check in and ask and what medications are in there, because sometimes you run into situations where you have a patient that's sick, they got UTI, pneumonia. You want to try to treat them in place if possible, before things get worse. They have new onset pain, they have anxiety. There's a few different medications in there. So in the event someone's sick, you want to make sure you can treat them in place and address their needs. As nurses, someone writes a script and you're waiting for the next delivery, you may need to check and see, do you have access to that in your Omnicell, Pyxis, whatnot. Providers, sometimes you may even want to ask what's in there too, because that can help guide something if you want to initiate something initially to get them to bridge the patient, and then you start something else later once the delivery comes in. That's a great option as well. So I just wanted to share that. Don't forget to think about that resource in the event something comes up and a patient has an urgent need.